Hi, I'm Dr. Gayana Shankarmurthy, Director, Nuclear Medicine and Theranostics at KIMS Max Bangalore. How do we prepare patients for radioactive iodine therapy after thyroid surgery? After thyroid surgery, in patients with differentiated thyroid cancer, we sometimes advise radioactive iodine therapy. The idea is to destroy any tiny bits of thyroid tissue or the cancer cells that might still be left behind in the patient. For this treatment to work well, preparation is very important. Why do we need to prepare the patient at all? Every day we get iodine from the food we eat. If there is already a lot of iodine in our body, the radioactive iodine that we keep will not be taken up properly by the remaining cells. So what we try to do is make those thyroid cells which are left behind hungry for iodine, so that when we give iodine 131, they absorb it nicely and the treatment works better. So what are the steps? The first one is the low iodine diet. For about 2 to 3 weeks before the treatment, we ask you to be on a low iodine diet. This does not mean eating less food. It just means that you have to avoid food that contains a lot of iodine. What are the food items you should avoid? You should avoid iodized salt. So instead, you can use non-iodized Himalayan pink salt or regular salt. Seafood contains a lot of iodine like fish, prawns, seaweed. So these needs to be avoided as well. Milk and milk-based sweets, curds, paneer, cheese needs to be avoided. It doesn't mean that you cannot even have a cup of coffee or tea, but milk-based products should be avoided as much as you can. And very salty foods like papad, pickles, chips, fries, packaged or processed foods also needs to be avoided. The aim here is not to starve, but simply to reduce iodine intake as much as possible. We sometimes do contrast CT scan for patients with thyroid cancer. If at all you have undergone contrast CT scan in the past, that is within 3 to 6 weeks, please tell us, so that we have to give a minimum gap of 6 weeks between contrast injection and radioactive iodine scan or treatment. This gives your body enough time to clear out the excess iodine, so the therapy works better. Then the third important thing in preparation is we want your TSH to be high, that is at least more than 30. But why do we need your TSH to be higher than 30? This is because TSH helps thyroid cells to take up iodine into them through special channels. Higher TSH means more of these channels on the thyroid cells that are left behind. So if TSH is more than 30, then whatever iodine, that is the radioactive iodine we give for either scan or treatment, will be taken up readily by these cancer cells. That's the whole reason we focus so much on TSH being high. Now, how do we increase TSH? There are two ways to do this. One is thyroxine withdrawal method, and the other thing is by giving recombinant TSH injection. What is thyroxine withdrawal method? In this post-total thyroidectomy, we will not start the patient on thyroxine supplementation. We do this at least for 3 weeks so that the TSH naturally rises above 30. During this time, some people may feel symptoms of hypothyroidism, which are tiredness, excessive sleepiness. They might gain a little weight or feel slow. This is temporary and this will improve once the tablet is started. The second method to raise TSH is by giving recombinant TSH injections. So in this method, you will continue to take thyroid tablets. We will give 2 injections on 2 consecutive days. TSH raises without making you feel hypothyroid. In simple words, to prepare for radioactive iodine therapy, we focus on 3 things. One is low iodine diet for 2 to 3 weeks, no recent iodine contrast, TSH above 30 achieved either by stopping thyroxine for 3 weeks or by giving recombinant TSH injections. All of this is done so that the radioactive iodine is taken up as well as possible, giving you the best chance of effective treatment. Thank you.